welcome to Agenda. I'm Ed Lingao sitting in for Cito Beltran. You're watching us via Signal TV 8 and 250, One News PH Facebook and YouTube or via the Signal Play app. You can also connect with us via SMS 0968 704 7736. And now for our headlines from the Philippine Star. The Philippines has sealed the supply agreement to buy 40 million Pfizer jabs last weekend. This marks the biggest vaccine deal signed by the national government to date. According to Vaccine Czar Secretary Carlito Galvez, the delivery of the vaccines will begin after 8 weeks starting in August. Meanwhile, the World Health Organization solidarity vaccine trials in the country are set to start, says Science and Technology Secretary Fortunato de la Peña. De la Peña reveals the delay in completion of the protocols for the trial was due to the addition of a third vaccine developer. And the secretary, however, did not divulge the participating vaccines. And Filipino men are spending more hours on chores for their family during the pandemic compared to before. That's if you believe a recent survey. According to the 2021 National Household Care Survey, Pinoys now spend an average of 8 hours a day compared to only 5 hours a day back in 2017. Maybe that's because they're stuck at home. The survey also revealed that the bulk of the tasks still fall on women. Okay, well, that's an initial survey. Let's now go to our first interview for this morning and for this week. Presidential Advisor for Entrepreneurship Joey Concepcion proposed implementing a separation of vaccinated and unvaccinated people in business establishments. And now to talk more about this, we have Presidential Advisor for Entrepreneurship Joey Concepcion. Sir, good morning and thank you for joining us.
Yeah, good morning, Ed.
Hi, sir. Well, sir, first of all, just some clarity with that proposal. Did we get that right? There's this proposal coming from your end. Well, not just from your end, actually. I think I read some other stories about this. There's a proposal to have some sort of a separation between vaccinated and unvaccinated people in business establishments.
Yeah, maybe let's take it in the right context now. We have been meeting with Octa Research and Dr. Ed Salvania, the private sector, trying to align basically the exit strategy out of this pandemic now.
Mhm.
And what's very important are milestones, no? When our seniors would be at least 50% vaccinated, when would we hit population protection, which according to Octa is defined as 40 to 50% of an area, in this case NCR plus, and when would we hit herd immunity, which is at 70% of
Mhm.
basically NCR plus. Now, in all of these, assuming we do hit certain milestones, how do we open up the economy safely? I think that's very important, no? As we open the economy, because more people will be vaccinated. So the key point here is the number of people being vaccinated. So that determines how much you can open your economy. The less number of people that are
Certainly.
vaccinated, of course, you can. Now, the idea is to protect both sides. No, we understand that there will be some people who will not want to take the vaccine, and there will be people that will be taking vaccine. So how do you protect those vaccinated from getting infected from those not vaccinated, and vice versa? Uh, the vaccinated people, there is a smaller chance, of course, of getting infected, but how do you protect now the non-vaccinated from these people? So the proposal is to put safe places for them. No, we've seen it in other countries. It's not we're not reinventing anything. In big arenas like what's happening in the NBA games, they put a section for the vaccinated and a section for the non-vaccinated. Moving forward in restaurants, there is a request by restaurant.ph that the current capacity of 30%, which is already allowed, plus 10% if you have
Mhm.
the safety seal,
Mhm.
the request is if they can add additional 20%, but the people that they will add are fully vaccinated. It's similar to also in areas that we have no smoking and smoking, right? So what are we trying to do here? We're trying to open the economy and make sure it's safe for both non-vaccinated and vaccinated. And that's the key element, because we don't want to go back to where you came from, and you've seen that in the case of UK, as they open the economy, and then they start now to slide. So they've held off opening the economy. They were supposed to do that a month from a couple of weeks ago. No, so that is the whole thing. For example, in buildings, another situation is we know that every elevator is limited right now because of COVID. Now, a fully vaccinated, the idea is one elevator can go with more people in that elevator if everybody is
If you're
vaccinated.
all vaccinated.
So, yes, so that's the common sense theory behind it. No? I mean, in a restaurant, you can have more people in that restaurant if everybody's fully vaccinated. But after consulting with Secretary Maynard Guevara, that is not allowed to disallow any non-vaccinated people in any premise, and I agree with that. No, this is not the objective to disallow the non-vaccinated. The idea of this is to protect both sides from getting infected,
Yes, sir.
and to basically that. No,
Yes, sir. So, sir, tell me if I'm getting this right. I'm trying to look for a parallel or for a comparative. Would it be correct to say that what you're looking at is uh, maybe perhaps putting up a premium premium space, you might call it that, for those who are vaccinated, not necessarily to prohibit non-vaccinated people from entering an establishment, but putting aside a special place for those who are.
no. For example, that's the intention. There is no special place. No, in smoking and non-smoking areas, there's no special place. They just put the smokers in one area. I mean, there are many ideas here. No, for example, the non-vaccinated can be more outdoor than indoor. If there
Mm.
is space. For example, like in movie theaters. No, if we are to open it up, how do we handle this? So you've got various movie theaters with many sections. No, so there may be a section there, movie house number one, number two. One area can be for fully vaccinated, and the rest can be for
Yes,
any.
sir.
It can be
Yes,
open to both. No, but what we
yes, sir.
want to do is to try to protect both sides. No,
Yes, sir. So, sir, yeah, sir. So, parang, well, maybe let's not use the word special space or special place. Pero, in other words, you could have areas which are common, but you could also have areas in an establishment where this is for the vaccinated people. I mean, I suppose parang ganun na sa atin. Kasi, may area na maaring, sabi nga ninyo, may area na maaring vaccinated lamang nandun.
no. Ang sinasabi namin is like maybe the best parallel to this is in wherever applicable. No, wherever applicable. That's number one. No, number two. I think this is not a mandatory thing that I believe that IACTIV should impose. No, uh, but maybe to me the best example is in just what we see in the NBA games. No,
Yes, sir.
there's a certain section. So that's the in movie theaters you don't maybe do it in a movie theater. You do it by time. No, let's say this time, uh, this the fully vaccinated will be at this time, and the rest of the time it can be mixed. No, so those who want to be extra protected both ways, then they have a different time to watch the movie. So these are just ideas that we're discussing at this point in time. I mean, their ideas have to flow in so that we can do the best, no, as we open the economy and make sure that both sides, the vaccinated and the non-vaccinated, are kept safe. No?
Yes, sir. Well, I think, sir, what I think what you're also trying to say is that there is no exclusion on the part of those who are not vaccinated. They're still
Correct.
allowed to go into the establishments. Yun lang. There may be some need, some sort of a need to add a bit of I don't know if you'd call it layering of some sort for the protection of both sides. Because you have different protection levels on both sides. The vaccinated and the non-vaccinated have different
That's
protection
right.
levels.
That's right. That's right. So the establishment will have to determine that. If there is no way to do it, and it's up to him to look at the risk level. No, if he feels that the risk level is low, as we get higher in the terms of, let's say, assuming we get to property, I mean, sorry, population protection already, at 50%. these ideas can eventually disappear, especially when you get to herd immunity. But
Mm-hmm.
the journey is, the target is to hit herd immunity by the end of the year,
Mm-hmm.
population protection by hopefully by September, October. But we don't know till these things happen, no? So, but the private sector wants to look at have certain visibility as to, okay, when we hit 50%, what happens? How many percent of how many? What would the capacities be in restaurants? Can it be increased? Uh, and etc. No, I mean, if we open back and allow people to watch the basketball games or bring in concerts, of course that will take some time. Where is that level? Will it be at herd immunity or will it be at population protection, which is 50%? So this is really part of the planning process, which I call the next normal. No, this is not
Yes, sir.
here to discriminate non-back
Yes, sir.
and
Well,
back. No,
certainly.
that's
Yes.
not the point. Yeah,
Yes, yes. Like I said, you're looking at different protection levels simply because some people are vaccinated and some people are not vaccinated.
that's right.
But
That's
sir,
right.
well, you have talked to Secretary Guevara about this. Does he see the need for a law to put this in place, or can this be done administratively? Sir, I think
I
can you hear
can
me,
hear.
sir? Yes, sir.
Yes.
Well, I was asking if this needs a special law to be passed by Congress, or can this be done administratively?
First of all, uh, denying entry for non-back is not allowed. That's very clear. But for uh, what they call separating non-back to back, depending on the practicality of it, is allowed, provided what he said is we cannot deny entry. And I agree with him. Nobody is
Yeah.
going to deny entry of non-vaccinated. So that is all that he said. No, and within whatever applicable, and you can have this safety precaution for both in the same manner that smoking and non-smoking. After all, we're after the total health well-being. No, we want to make sure that the health protocols are maintained. No, as you increase capacity of any establishment, the risk becomes higher, and the risk also becomes higher when what do you call this? Of course, capacity goes up, and you want to ensure that there is a balance of those who are vaccinated and non-vaccinated. So, to increase the capacity, you might be able to allow a certain section for both, no, so that each one can protect each other. But I believe as we move at higher rates of vaccinating our people, then all of this will eventually disappear, no, and we get back to the next normal. Now, how is that journey to getting to that next normal? No, that's the key. You don't want to slide back. You want to open, but you don't want to slide back. So you have to look at all of these other safety parameters that you can introduce.
Mm-hmm, mm-hmm. Well, sir, I asked about whether or not you would need a law because it would certainly help the private sector if there is a cover law that puts this into place. Secondly, that also helps the private sector in avoiding accusations of discrimination. I mean, like it or not, there are some people who might raise that issue of discrimination if they're not allowed to go to certain sections at a certain time of the day. I mean, like it or not, that sometimes really happens. So it might really help you if there is a cover law or a cover ordinance. For example, the rule on smoking and non-smoking sections that's covered by ordinances, and that helps establishments to enforce that.
Yes, it depends on the LGU as well. No, I believe but according to him, and I'm just sharing with you that what is not allowed is denial of entry of non-vaccinated in any establishment. So that's, of course, a private home is a private home. No? You can deny entry. That's your home. No, or so. I mean, what is not allowed is to deny entry of non-vaccinated, and that's not the intention after all. Because what we want to do, and especially all of these establishments, is to encourage entry of both. No, but ensure that there is adequate protection for both sides. So that's the intention. And according to him, that is allowed, and that is within the legal framework. So there is no need
Mm-hmm.
to put a law that protects both non-back and back from infecting one another. And if you were to talk to OPTA, while there is a various level of degree of whereby a non-vac can, of course, the non-vac has a higher uh, chance of infecting somebody than a vaccinated person. But of course, a vaccinated person, because of depending on the efficacy of the vaccine, can still be contaminated, no? And can be asymptomatic and therefore infect also the non-vaccinated. But the idea is, of course, those vaccinated, the risk of infecting someone is definitely much less than those that have not taken the vaccine. So there is
Mm-hmm.
no uh, plan to deny both, no entry. The idea is how do we help create, that there is adequate protection for both sides, and wherever applicable, and of course, if the LGU mandates it, that's it they can do so. I was saying that this can be all, voluntary on the part of the private sector, but within a certain framework. No?
Mm-hmm. Or you might call it a move to establish safe spaces in establishments. Safe spaces meaning that the people who are in
Correct.
certain
And
areas would have a lesser viral load because of the fact that they're vaccinated.
it, in fact, that's in our star. That's what they called it. No, safe spaces. No, making the place safer. No.
Mhm. So, sir, let's talk about timetables for this proposal. You already mentioned that, we are looking at the population protection by September, October this year, and hopefully herd immunity by the end of the year. Are we waiting for those two milestones before we look at having this system in place? Or are we looking at something already being put in place in the next few months?
No, these are all part of the planning process on how we move towards that exit strategy. So, will movie theaters be allowed to reopen? Will people be allowed to watch, assuming the PBA games, things like that? No, if you look at America, they start to do all of that when they hit 50%, which is basically population protection. So, I believe that we should look towards, once we hit 50% of the population, then we can move towards that direction. No? Allow people to watch games, allow more things to happen. No? Of course, but still maintaining certain controls. No? Wearing a face mask is very important, and all of these things. No? Social distancing. So you'll have to find a solution. Now, these are what I call broad concepts, ideas that are will have to come into place. So it's up to, in the end, IATF to approve it, whether it be they mandate it or they leave it to the owner of the establishment, the restaurant, the building. And I prefer that this be within the parameters. Each establishment may want to adopt it, no, or we may not want to adopt it. No?
Mm-hmm. Are you saying, sir, that owners can put this into place right now? I mean, is that the idea that since you're saying that there's no need for any law, then that this could be put into place um, by certain establishments if they have the space already?
Yes, it is not prohibited to create a safe work, either a safe working environment or a safe place for people to ensure that when they go to, whether it's a restaurant or whatever is allowed now, no, movies are not allowed, and watching of games like basketball is not allowed. So, uh, whenever it's allowed, then the owners can look into how they can open up, or they can propose to the idea if they can open the theaters under these following conditions. No?
Sir, I'm trying to let people imagine this. Trying to let business owners, for example, who are listening in, imagine how this can be done. For example, in a medium-sized restaurant, how would you operationalize it, or how would you imagine it being done in a medium or large restaurant where there's
Well,
space, I suppose.
let's put it this way. Well, these things will not really work, no, in a QSR, no. I mean, quick service, because the time that you stay in there is very short compared to maybe a casual dining or a fine dining or a movie theater or a sporting event. No, so the risk becomes higher, especially when it's indoor. We all know that. No,
Yes.
and if capacity is, let's say, good for 50 people and you pack it 50 people, then the risk becomes higher. Now, the since what people can do is if they don't have enough indoor space and they have outdoor, then they can very well allow those non-vaccinated to be outdoor because it will be safer for them. No, and those that are vaccinated can opt to be anywhere. No, they can opt to be outdoor or indoor. No, so that's these are ideas. No, I mean, I don't own a restaurant, so I can't really say what is best. And I think the restaurant owners would know how to handle this situation. It's similar to also when you go in some restaurants, there is a dress code, no, so they can deny entry. But in this case, you cannot just be you even if you haven't taken the vaccine, you cannot be denied entry.
Mhm. Parang health code.
That is very clear with Secretary Maynard.
Mhm.
Yes, yes, health code or whatever. But what I'm trying to say is that uh, as we open up the economy, and we really have to do that, though, you can see what's happening to our economy. Now, when we do that, we have to ensure that we don't go back to where we came from. That's what I'm trying to say, especially with the Delta variant, which is the Indian variant, which is quite a
Mhm.
very treacherous type of variant. We have to be extra careful. But then again, we cannot keep the economy closed forever. No, it's going to be difficult. But the key to all of what we're going to do is we need to vaccinate the people. Now, it will take time, but now as the vaccines start arriving with the 40 million doses of Pfizer, all of these things will allow us greater. Uh, People will have more access to vaccines, and as you will be able to hit population protection sooner, no? And even if we don't hit herd immunity, population protection alone is adequate, no, to open up the economy already, as seen in America. You've seen them opening up the restaurants, opening up the games. People are moving out, watching movies, and pretty soon, I think they will be declaring the removal of masks, which I would not do, no, till maybe we hit herd immunity, but then with extra caution because we never know that
Mhm.
whatever variant comes at that point in time.
Okay, Secretary Joey, you already mentioned the vaccines. We'd like to go into the vaccine importation in a little while after we go into this break. So please stay with us. We'll just go into a short
Thank you.
gap. You're still watching Agenda. We are still with Presidential Advisor on Entrepreneurship Joey Concepcion. Some good news over the weekend. 40 million Pfizer shots were purchased by the Philippine government, bringing the total to 113 million doses from five drug manufacturers. Secretary Concepcion, thank you for staying with us and welcome back to Agenda. Sir, we of course everybody's excited about the private sector vaccines that are expected to come in sometime next month. Can you give us an update on exactly how many are coming in the next few months and exactly by when?
Well, for AstraZeneca, it's confirmed that on mid-July and mid-August, we have 1.17 million doses arriving on both months. No, 1.17 for July and another one for August. We want to see better visibility on the next arrivals because the total order of the private sector is close to 6 million doses, and that of the LGUs, which joined the dose of a program earlier this year, that's another 11 million. So that's a total of 17 million doses that will be arriving between July all the way till about February next year. No, the government, our donation to the government, uh, is is arriving on February next year. No, because we requested that allow the private sector to take our doses first, which they agreed. But now that Galvez has told us that we don't need to donate anymore, so those doses on February arriving will go back to the companies, which they can reallocate whether to give it now to their families or donate it to LGUs that help them, or possibly if AstraZeneca says that this current vaccine can be the third dose, then it can be used for that purpose. No? But at this point in time, AstraZeneca is still studying whether this is possible as a third dose.
Mhm. So, sir, totally wala na pong donation as agreed on last November. Completely wala ng donation ng private sector.
Yes, we didn't. It was Secretary Galvez who told us that we don't need to donate anymore, and they have adequate supply already, and which is fine. And we will we the doses that are arriving is enough for our employees and some family members. So this is an additional dose that we technically did not plan for, but now we can. There are many uses for it now, as I mentioned. No?
Yes, sir. So, sir, the question on a lot of people's minds right now, exactly how will this be rolled out in the private sector? This yung initial na 1.17 million coming in July. Kasi, di ba, right now, when there's an arrival now sa airport, diretso yan I mean, diretso sa national government tapos sa LGUs nag-distribute. What about the private sector? When this 1.17 arrives next month, who takes in the vaccines and how is it going to be distributed?
Well, right now it's Wellegus handling both AstraZeneca and Moderna, so that's perfect. These are the two vaccines that are clearly arriving as scheduled. And upon arrival, Welleg will take the vaccines and put it in the storage. We are ready to execute immediately, even the next day, because we've already contracted the different vaccination centers now that are outsourced now to also private sector healthcare groups now. So, and of course, many of the companies, including San Miguel, SM, Ayala, they put up their own vaccine facilities, which they have opened up also to the other AstraZeneca buyers. No? So we're ready. Since this has been delayed for about 3 weeks, we were ready to implement this in June. So definitely will be better prepared for July. So we're just waiting for the arrivals. And I think the same thing is also with Moderna. No? Moderna, there's I think this coming July they will be starting also.
You mean the vaccinations of the private sector will be devolved to the companies themselves? I mean,
That
or are there major
that's right.
aggregations of companies that have banded together for common vaccination centers?
So, for example, if you're medium-sized company, your doses will be much less. So you will have to group with different companies, or what you can do is there are vaccination centers that are offering their services. No, either it's you can work with the LGU, you can work with San Miguel. They've offered the use of their facilities. Of course, they will prioritize their employees first, but then, so there are many alternatives. No, companies have grouped together to be able to hit the minimum quota to to, because it's a quota that you have to attain per day, depending on who the service provider will be. No, but that has all been laid out already, because as early as June we were ready. So it's a matter of just implementing. The second thing is ensuring that our employees take the vaccine. So there has been an increase of number of willingness of our employees to take the vaccine, but there's still quite a number of them who are hesitant. No? And so we're still relentless. We are trying to convince them and telling them that the issues. And of course, we cannot take any action against employees who don't want to take the vaccine. We really have to convince them.
Well, that's an interesting statement. How do you find that balance within, for example, a company, let's say a big company, where you may have people who do not want to be vaccinated versus people who are willing to be vaccinated? How do you find a safe space in the private sector?
First of all, what we would do, I mean, at least in our company, those guests who are unvaccinated, since the building is private, we will put a section for them, no, to meet people. So there'll be separate meeting rooms for those unvaccinated who are not employees to come in. Now, for those unvaccinated employees who work in manufacturing, uh, there's no choice, but we will have to accept that, in the sense that the risk is still there. But if
Mhm.
I believe, if you look at if you look at herd immunity at 70%, no, so let's assume our company is attaining at least 80%. So the 20% that are not vaccinated, there's still a risk, but more or less bulk of the population has of that company has taken the vaccine. So there is what I call adequate protection already. And what we would have to do is the unvaccinated people, we will just have to do the usual protocol, similar to what we're doing with others. We just monitor them for any symptoms as they move along. There's nothing illegal about that. No.
Mhm. I asked that because, well, honestly, I'm really interested in trying to figure this out. I don't know how other countries handled this issue. Of course, you will always have people who are not willing to be vaccinated. You have people who are willing to be vaccinated. How do you find a common ground or a safe ground in protecting everybody, in protecting everybody's interest, and in protecting, in enforcing health codes, especially in the private sector? Kasi, diba, it is the private sector. You do have authority over your property. You do have authority over your employees. And to a certain degree then, di ba? When an employee is sick, he's not supposed to go to work. Is there a parallel here? I'm just exploring. I'm just thinking aloud.
Yes, true.
Moving forward,
There,
what
I guess
solution do you see here?
well, if we, for example, if company A has 90% of its employees vaccinated, so basically there's a 10% that is not vaccinated, the risk is much less. So we will try to do certain protocols that will protect both sides. No?
Mhm.
90% or 80% of its employees vaccinated is far much less than if the unvaccinated is higher. So if we look at population protection at 50 and herd immunity at 70, assuming your area is confined, yeah, you have, I would say, a much better protection than before nobody being vaccinated. Now, over time, peer pressure will happen. No? Of course, their co-employees will say, "Oh, kunin mo na ang bakuna kasi lahat kami." So, I mean, eventually, some people will want to stay with only those who are vaccinated by nature. No, I mean, among families today, I've seen all family members take the vaccine because it is, they want to protect their parents. They want to be allowed to enter family gatherings. So the Filipino family is very solid, no. So once you focus your vaccine plan on the family, the success will be higher because among that family group, they will want to protect one another. It starts from that. So that's why we are going to also support the family members of our employees. And if that happens, then the acceptance can easily go up to 100%.
Yes, sir. Well, of course, we all want that to happen. We all want the ideal. In the end, people should be willing to get vaccinated. But at the same time, sir, I mean, honestly, at the same time, you still see people on social media saying that there is no such thing as COVID. I mean, even at this time, you have people who are still denying that there's a virus.
I totally agree with you. And well, we can't change certain people's mind. They have certain beliefs. Let's just accept that and let's both protect ourselves and protect them. And this is why we're looking at all of these ideas. And some people will say it's discriminatory. I don't believe it's discriminatory because this is a public safety concern, and this is we're in a pandemic. This is not a simple dengue, you know what I mean, or
Yes, sir. Yes, sir.
virus out there. This is you can see the magnitude of death that is happening out there. So
Yeah.
I think you will. I think the acceptance level of people wanting to be vaccinated is going higher. As the supply comes in, it will be higher. If we are able to be lucky to hit herd immunity by the end of the year, then there's no need even to have these restrictions. But certain people will still want, assuming you hit herd immunity, certain people will still wear face masks and face shields, and will only want to be with people who are vaccinated. You can't help that.
Yes, sir. Okay. Presidential Advisor on Entrepreneurship, Secretary Joey Concepcion. Sir, thank you for joining us, and happy Monday to you.
Thank you, Ed.
Thank you, sir. That was Presidential Advisor on Entrepreneurship, Secretary Joey Concepcion. I think we're going straight to our next guest for today. Am I correct, Arvic? Yes. Okay. Our next guest for today is Dr. Nina Gloriani, one of our favorites, the head of the vaccine expert panel. Now, more than 350 Indonesian health workers have contracted COVID-19 after being fully vaccinated with Sinovac. Most of the workers were asymptomatic and isolated at home. Is this something to truly worry about? And for that, let's go ahead and ask Dr. Nina Gloriani. Hi, ma'am. Good morning and happy Monday.
Good morning, Ed. Yes, we've been talking
Well,
about this Indonesian
yes, ma'am. Actually, well,
incident.
I think somebody put it into context na nung Friday pa lang. I think it was somebody from Okta. Father Nick Ostriak was saying na you have to look at the context daw na these are health workers who are naturally more exposed than the normal
Yes,
people to the virus. So you would really expect higher infectivity rates
yes,
in the
that's true.
population.
Yes, that's true. And of course, there were two groups there who were saying that the Delta variant is actually causing the surge in cases among the vaccinated. And there's another one that says even the other variants, like the Alpha variant, which is the UK variant, is also very high in such groups. Okay, so we always say that these vaccines do not protect against may not protect against mild or moderate, but would protect more against severe form of the disease.
Yeah.
And we have seen this among these cases. I think around 350 of them, most of them were actually mild. So that is still in keeping with what we've been saying. But of course, those who have comorbidities or maybe those who are more senior healthcare workers somehow were placed in under ICU or were hospitalized, or I think even one died. So we actually expected this. But what we want also people to know is the variants are real. There are many studies already with various vaccines on the immune escape or the lower efficacy against this variant. So that is why we keep on telling people that the vaccine is not enough. So we still have to follow all of these minimum public health precautions, precisely until we reach that. I was listening to Sir Joey's interview. No, precisely we have to reach that level of protection before we can sort of be complacent and relax in our precautions.
Ako ma'am, dami kong gustong tanong sa inyo tuloy. I'll give you a quick rundown of the things I want to ask you about that.
Okay, sige.
Number one is the variants, of course, especially the Delta variants. I know we have that already here, but we don't have local transmission naman here of the Delta variant. So far, that seems to be okay. But I want to go into that. Exactly what should we be worried about with the Delta variant among other variants. The other one is yung pinag-usapan namin kanina with Secretary Concepcion, the proposal of the private sector, and I think already with the cooperation from DOJ, it's a bit of a touchy issue. Exactly how to describe it. Putting up safe spaces for in establishments in relation to those who are vaccinated. In relation to those who are not vaccinated or refuse to be vaccinated. But how do you find that safe space, and how do you not be discriminatory, and how do you be fair? That I think might be a touchy issue. And thirdly, basis, dami, no?
Mamaya na yung third.
Sige.
Yung una muna. I'll talk about the variant first.
Sige.
Okay.
Sige po.
Among the variants, of course, we have now 4 variants of concern. They are all transmissible, highly transmissible. Yes, but before the Delta variant appeared, the Alpha was more transmissible than the others. Now, in addition to the high infectivity or the high transmissibility, we're talking about immune escape. You know, the vaccine that we have now, the prototype, ito yung first generation vaccines, do not work as well with the variants as they would with the original strain. No? So, various degrees of neutralization or protection. Like they have shown that for the Alpha variant, for instance, ang efficacy was a little lower lang. So if we are talking about 3 times lower, something like that. Now with the Delta variant, however, this came in a little later, so they only have some data right now. But what they have shown so far is that it is more highly transmissible, so even higher in infectivity than the others, especially the Alpha, and also seems to be not working as well with the prototype vaccines. So if the South African variant, and this is the beta ito yung beta, no? Between Alpha, UK, and the beta, mas mababa yung protection against the South African. But with the Delta, it's even lower. So we're talking about the Delta is worse than any of them. That is probably the take-home point there. So we do need to be very careful, but maybe I will go back to the basics here. What happened in Indonesia was that they went through Ramadan. So these people, these healthcare workers, maybe even the others, became complacent. They wanted to gather. So also they have maybe pandemic fatigue. They just, refused
it's the breaking of the fast at night. That's when people gather.
Yes. So the surge in cases followed that pattern, after like what happened in India following that river festival.
The Ganges,
yes.
The Kumbh Mela festival.
So while you are vaccinated, you may feel you are protected, but that may not be so when you have a variant amidst you, secretly.
Ma'am, if you may ask, can we do some sort of comparatives? For example, the Alpha, Beta, Gamma, Delta, in terms of vaccine escape or immunity escape, how much?
So right now,
these are numbers. I'm just pretending that.
No, just siguro parang ganito, plus 1, plus 2, plus 3, plus 4, parang gano'n. Actually, WHO, I recently attended an update on the evolution of variants. Now we have to monitor what's going on. So we have this WHO presentation that says, if talking about escape, plus 4 si Delta variant, plus 3 si South African variant, which is Beta, and then maybe plus 2 or even plus 1 ang UK variant. And yung Brazil, maybe plus 1, plus 2 also. So it's the Delta variant that is being watched now, and unfortunately, not too many vaccine companies have been studying it, but now they are studying the effect of their variant, of their vaccines against the variants. So plus
Ma'am,
4, plus 3, plus 2, plus 1.
parang mas mahirap ata yung number.
Ay, hindi. Yung pinakamahirap, nag-escape si Delta. Siya yung,
Okay. Well,
siya
that
yung
was
number
clear.
1. And then South Africa. South, yung Beta. And then
Beta,
yung dalawa medyo pareho na lang. Like UK and Brazil. So yun yung so far data. We do not know because they're still studying every day this information change. So but right now,
ma'am, just so we all get it right, mas infectious, mas transmissible itong
both.
Most transmissible itong Delta.
Plus
yung vaccine escape.
Yes. Siya yung pinaka-worst. That's why we have to be very careful that it does not come or it does not spread yung sa community transmission. So far na parang napigilan, no? Diba? We have 13 cases.
And when we say po vaccine escape, this means na mas limited yung kanyang protection against infection. Even though you have the vaccine.
Against particular variants.
But at the same time, just for context, naman, vaccines naman are not really there to prevent you from getting infected. They're there to prevent you from getting seriously infected.
Yes. That's what we know so far for COVID vaccines. Yes.
Except lang na mas nakakalusot itong Delta variant.
Yes.
Mas swabe o mas
That's why we have to be careful.
But nabanggit ko kasi kanina na even with the vaccinations, we still have to maintain the health protocols. So does this mean that even after you have 70% vaccinations, herd immunity and all that, you still end up with face masks?
No. At some point, we will have to make recommendations to get back to yung parang normal na that maybe slowly yan, as what Sir Joey said, no? Slowly. All of this data will have to be considered, the trend of infection, the immunization coverage, all of them will have to be considered. So slowly, hindi naman. We will not be there forever. Yun naman ang may goal tayo to remove all these PPEs.
So there will come a time when we will see each other's faces again. And not
yes, so nice naman. If we may go now to your second question. Sorry,
Hindi pa ako sigurado kung tapos na ako dun sa first eh.
Sige, go ahead, please.
I'm trying to imagine kasi our world by next year. I mean, it's been a year that we've been wearing face masks and since December face shields. I'm wondering by January of 2022, would we still be having to wear face masks and face shields if we come to that?
Well, maybe we can do away with the face shield later. Hindi pa ngayon. I keep telling people that kasi medyo may lumabas na ganong, di ba? Parang pronouncement na hindi. We don't, we don't go for that, sorry. So, pero eventually, yes. Kasi if we have this level of protection na, nyari within the family, lahat kami bakunado na. Wala na kaming problema. We can, wala nang ganyan-ganyan, no? And then, of course, we know who will be coming in kung if we know somebody is not vaccinated or we do not know the status of vaccination of those who may come in. We're careful. We will again, our mask, our face shield. So we get our protection again. Yun.
Okay, now that you brought it up, we can segue to question number 2. Pero ma'am, I've been advised by the producer, we have to go into a break first. A quick break lang.
That's correct. All right, yes.
Let's go into
okay,
number 2.
Yes.
Thank you po. We'll just go into break, so please stay with us. morning. You're watching Agenda. I'm Ed Lingao sitting in for Cito Beltran. We go back to our guest this morning, Dr. Nina Gloriani of the head of the vaccine expert panel. Ma'am, before we went into the break, we were already talking about yung proposal by the private sector and the DOJ for some sort of a safe zone in establishments. Of course, it could be a touchy topic for some people who might look at it as discrimination of some. Kasi you're looking at how the vaccinated and the non-vaccinated would be interacting in a public space, in an enclosed public space, for example. What your thoughts on this first? Conceptually first, what are the considerations when you look at the vaccinated and unvaccinated people in one common space?
Okay. Well, first, I'd like to react to what Sir Joey actually mentioned. There is wisdom and fairness in what they are planning to do with respect to sort of somehow segregating, not really physically, no, in a lawyer's context, no, the vaccinated from the non-vaccinated. But what I'd like to say, he went through all the possible scenarios and the choices that people, establishments may have. But my take on this will be more on my choice as a person who got vaccinated. So I'm looking more at people getting the vaccine or who have been vaccinated to draw the line for themselves and for others. So if let us say a private company cannot do that, or a government entity cannot because of this law of against segregation, discrimination, so to speak, it's up to the person to avoid such places. So like me, I'm vaccinated. Why would I go to a place where I know there will be a mix of vaccinated and unvaccinated? So it's up to people to make the decision for themselves. So that is my take on that. If we cannot make any sort of pronouncement, but under a pandemic, and this is, even with a public health emergency issuance, already governments can dictate what should be done in terms of containment, but maybe up to a certain point, because we still had to deal with some loss of the land. But as I keep on saying, under pandemics, we can make declarations, we can make policies to protect everyone. We are just being very careful with this. We want to be as fair as possible to others. We want to convince more of these people to actually get vaccinated and be protected so they can mingle. Now, if they choose to mingle with us, I would be very careful and wear again my face mask and my face shield and keep distance and stay for only a short period of time. It's up to the person who is vaccinated to draw the line.
It is a public health concern. I mean, it is a public health issue.
It's
not a private issue. It's a public health issue.
No, it is a public concern, and we've been in it for 1.5 years now. And the trends are showing that we may be in it for another 1 year or so, with these variants coming in.
Which is why I was asking Secretary Concepcion a while ago if there's a need for a law to put this into place. Kasi in the end, it of course becomes a stronger policy statement if it is backed up by law. In the same way that you would have laws on smoking and non-smoking areas in the public sphere.
Yeah, I believe in that. But I am not a lawyer, so. But I know that we have these international health regulations where most of these policies should be there. I think that could be reviewed as well. So maybe not that drastic in the sense that this is for vaccinated. Not something like that, but something that will also compel people to get protected. Something like that, We want to, as much as possible, respect everyone's choice. But the choice has to be a responsible one. To protect yourself, protect others.
Okay. The parallel that was being drawn kanina was that I told kanina was what if you put up a premium space for the vaccinated people na kailangan pwede dito? Parang mabuhay class ba? Ano yun?
Yes. I go for that. Sorry.
Oh,
But that's my personal
pag ikaw
opinion.
bakunado,
Pupunta ako sa lounge. Yes.
I hope I'm not being politically
No, no.
not being politically incorrect here.
It's just fair, being
it's not to do
fair.
with comfort, diba? It's not to do with comfort.
No. It's fairness.
Yeah,
You want to
yeah.
protect yourself. Fairness, justice,
And
ano bang tawag
that
doon?
you go home too.
I don't know. Yeah. I will go
Sense of
for
civic
that.
responsibility is the way I want to put
Yeah.
it.
Yun nga, sabi ko, yung konteksto ko is one who is vaccinated. It will be my choice to mingle or to not mingle with others. And if I do choose to mingle with those who may not be vaccinated, I will protect myself. So may kabyat doon. Merong kang additional layer of protection. You will not really avoid them, pero and you expect the other to have that layer of protection as well. You know, kasi protect others also. Ayaw na nga niya mag-protect sa sarili niya. Protect naman niya yung iba from him kung sakali asymptomatic siya. You know, we all have a responsibility.
Yeah, it's civic responsibility. It's one thing na hindi ka ma-vaccinate dahil hindi available o hindi pa kayo natatawag. Iba yung
hindi ka kwalipikado. Oo, yeah.
Iba yung ayaw ko lang talaga.
Pero iba yung ayaw mo. Pero pwede ka. Di ba? Yung sabi ko parate, if qualified, go take the job.
I hope I'm not being politically incorrect here. Pero I meant to ask you that.
Nawala. Teka, paulit. Ed, nawala ka.
Okay, we're back. I'm sorry, I think I got cut for a while. Dr. Gloriani, hi. Thank you for not leaving us. I'm sorry, I got Indian. It's about life. It's not about the law, diba? Indian. It's about public health.
Public health responsibility for yourself and for others.
Yeah. Okay. Ma'am, teka. I think we don't have enough time anymore, but sisingit ko lang yung isa pang tanong, yung number 3. Question number 3.
Okay.
Binanggit mo na kanina face shields. Ano ba talaga? We've had a public pronouncement from the president, and we have had some confusion actually until now on the policy. Medically, where do we stand?
I know some of our infectious disease experts already were consulted about this, and no, we do not want the face shields to be removed at this time. With all these variants, with all these cases rising in the other parts of the Philippines, even in the NCR plus bubble, while we are seeing some slowing down, we're not yet off the hook, so we have to maintain that. So there is added value or added protection when we put in that face mask. Kasi, di ba, the face shield, the face mask will only cover the mouth and the nose. The eyes will be covered by the face shield. And, you know, kasi merong mga splashes dyan eh. So that gives you better protection, higher than 95-97%.
Okay,
Yes.
Dr. Nina Gloriani of the Vaccine Experts Panel. Ma'am, maraming salamat for joining us, and happy Monday to you.
Yes, happy Monday to you too. Thank you, and bye.
Ingat po. Have a good week. And that's today's agenda. Keep it here on Cignal TV Channel 8 and 250 for the latest news. I'm Ed Lingao, sitting in for Sito Beltran. We are one news.